In the ever-changing world of business, an organization's success depends on constantly meeting new challenges and adapting to the marketplace. I'm Greg Gumbel. From e-commerce to investing, business strategies to human resources, join me as we take a closer look inside the workings of the modern global economy. Welcome to the Economic Report. The effects of new technology are best seen in the world of medicine, where it continues to improve lives every day. Let's examine this next story.
While the medical industry has made great strides in utilizing the latest in diagnostic and treatment technologies, many physicians and other healthcare providers in the primary and community care environment are still depending on paper-based methods and ineffective software for recording and managing patient information.
Recording of health information is becoming progressively more complicated as medicine super specializes and as a variety of different health providers engage with the patient. One of the interesting things about me is that I'm both a doctor, I've been a patient, I've been a consultant to the healthcare industry, and now I'm running a healthcare software company. So I think that gives me a range of points of view, and the goal is to achieve better health outcomes within an increasingly constrained budget.
After practicing as a physician, then doing an MBA and working at the Boston Consulting Group for a number of years, he founded Intrahealth in 1997. A leader in healthcare software, the company has operations in New Zealand, Australia, Canada, and Europe, and it will soon enter the U.S. market.
The three main stakeholder groups were the health professionals, the people delivering care to patients, the patients themselves, and the health system managers. Health professionals want to deliver the best quality of care they can to the patients. Patients are increasingly looking to be engaged in their health care. They're researching on the internet and want to be part of treating themselves and making themselves healthier. And health system managers need to look at how the overall health system is going in terms of outcomes and how the budget is being spent to achieve those health outcomes.
Each constituency wants something different.
Healthcare professionals are looking for systems that are easy to use and help them run their business. Health system managers are looking for systems that can collect outcomes and costs for a given population that they're managing, and patients are looking to engage more directly with their health providers.
Catering to the needs of clients around the world, Intrahealth's healthcare management software is being used at more than 600 locations.
Our product is distinctive in that it was designed with a great deal of flexibility from the ground up. This flexibility allows us to customize the product or configure the product for each individual specialty and even each individual user. This flexibility has allowed us to use the same product in several countries.
The company has developed 4 unique products.
Profile is a health business management as well as electronic medical record for both generalists and specialists. HCC provides for case management and workflow. InSync was designed for population health management. And Accession provides consumer-based access to personal health information as well as real-time transacting between the patient and their healthcare team.
4Med Clinics Inc. is one of British Columbia's fastest-growing healthcare clinic communities.
I think the big issue working in a group practice is legibility. And so you see a patient who has been seen by one of your colleagues, and it's like you need the Rosetta Stone to decipher the hieroglyphics on the page. Now, with the EMR, all of those encounters are there in typed text, and so, it's just not an issue.
Surprisingly, often physicians say they can't realize how they function without electronic medical records. Really, the journey is a progressive journey from moving from paper to a computerized record. The speed of the journey is unique to each individual situation. It's not uncommon at the beginning of the journey for some increased workload, but by mid-journey, the efficiencies are realized.
Hi, Boris. How are you doing today?
Nice to meet you.
Intrahealth was created to try and bring some sort of rationality to the highly fragmented community or outpatient phase of care. And because it's our reason for being, and because I passionately believe in this, it's very gratifying when we see that we're improving people's health, we're improving health outcomes for a population, and we're also helping the health system constrain its cost inflation.
Thank you very much.
All right. Yeah, see you.